So the goals of the study were to look at the long-term adverse event reporting in patients in two very large global phase 3 trials known as the Cougar 301 and the Cougar 302, where we looked at Abiraterone 1,000 milligram with 5 milligrams of oral prednisone twice a day versus 5 milligrams of oral prednisone twice a day. The 301 trial was for patients who had received chemotherapy and had M1 CRPC. The 302 trial was for patients who had not yet received chemotherapy. In looking and reviewing the corticosteroid adverse event related profiles for several years now, in both trials and all arms of the study, we found that the difference between those patients who received abiraterone and the prednisone twice a day versus those who were in the control arm of prednisone 5 milligrams twice a day was completely inconsequential when we looked at issues of hyperglycemia or weight gain or weight increase. And this is in patients who were followed now for at least a period of 15 months to 2 years and more in some. So I think it should really give reassurance to physicians that a low dose of 5 milligram prednisone twice a day, the incidence of these challenges was in a low single digit percentages, anywhere from about 6% for patients with any sort of significant glycemic issues, which quite frankly most of them were of low grade, low incidence, but also easily manageable with oral hypoglycemics and diet modifications. And likewise for any issues of weight gain or weight increase, also managed either with weight reduction strategies or also occasional diuretic utilization, but of a very low incidence. But essentially, the difference between the two arms was inconsequential.